Hello, everyone. It is noon, so I'd like to go ahead and get started. Welcome to all of our participants. We can't necessarily see you, but welcome. Glad to have you here. I am Britany Waddell. I am the Assistant Planning Director for the City of Raleigh, North Carolina, and Board Member and President-elect for ITGA. Thank you so much for joining us today, as I said, and on behalf of ITGA and the National League of Cities, we would like to thank you, and we appreciate your participation in today's webinar, which is entitled Reopening in the Fall, City and University Collaboration Amid the COVID-19 Pandemic. We have an hour with you today, so we have a lot to cover, but I wanted to start with some housekeeping and announcements. We hope that this webinar will prove helpful and informative and spark conversations that can continue well after today's event. As you have successes in your efforts to bring your students back to campus, we would love to hear from you and to have you share those experiences and the challenges that you face. To that note, ITGA is currently scheduling focus groups on reopening that will be held September 21st, 23rd, and 25th. And details are still being worked out. So please be on the lookout for more information in our newsletter. The chat feature will be live during the webinar today, so you can share information with other participants, but we do ask if you have a question for the panel, that you use the Q&A function. Staff will be monitoring that form, and we hope to answer those questions at the close of the webinar. Please provide a contact email with your questions, as we would like to answer all of our questions, but if we aren't able to get to them live, you will get a follow-up after the webinar is over. I will note that today's webinar is being recorded. And today's panel will be providing an overview of their institutions and municipalities and speak briefly about issues such as handling of pandemic-related supplies, communication with students and community members, and also accountability and enforcement on and off campus. Then we'll jump into some prepared questions, and we'll end up with the participant questions that we received. So without further ado, I'd like to welcome our wonderful panel. Joining us today, we have Suchitra Webster from Michigan State University. Wave, Suchitra. We have Marc Baker with Colorado State University. We have Tom King with State College, Pennsylvania, and also Councilmember Tanaka Vercher with Nashville, Tennessee. So we're gonna have Sue kick us off with the briefings.
Wonderful. Thank you very much for having me, and I hope we have a really fulsome, robust discussion, if you will, today. So I am the community liaison at Michigan State University, reporting through Student Affairs and Services and also through the Office of Government Relations. You see a slide that's up here because we felt it was important to give you a quick context on the institution or municipality we were representing. And I won't go into great depth about it, but MSU is a large Research One institution. We have 50,000 students, and about 78% of our students are undergraduates. And that's important because those are very traditional undergraduates, meaning they're between the ages of 18 and 23 and have a significant impact on East Lansing, which is our home. So I also want to mention that we have roughly a fifth of our students are students of color. We have 11.4 international students, international students, 13,000 employees. And that's important, again, in the discussion of COVID pandemic and things that we are working on, because some of those employees are also unionized. So you can take a look at the rest of those stats for the university, but I would mention that we are a campus that's about 5,000 acres, and we are literally across the street from the official city of East Lansing, even though we are part of East Lansing. So there is Grand River Avenue that separates us, but 69 to 70% of our students live off campus. And so let me also take a moment and tell you about the community at a glance. So East Lansing is our home, about 48,500 folks there, but many of the people that live there, over 50%, are students. So that's important to note. We are literally a couple of miles from the state capitol, which is in Lansing, Michigan. And what I would really want to leave you with here is that it's very much a Midwestern ethos and a small town feel. It is very common for people to know one another, to say, oh, my neighbor's a faculty member at the university, and, other folks we know by name or we grew up with them. And so just to give you a sense of what our community is like. When we were preparing for this discussion, we talked about beginning in our very, very brief remarks by providing you some information about 3 topic areas. And the first one is supply distribution, which sounds so broad, and there's a lot to cover, and hopefully in the question and answer portion, we'll get to do more of that. But in terms of our supply distribution, and like many of you, I'm sure, we have decided as an institution that it is important for us to provide safety kits to all 50,000 of our students. And those kits contain, things like hand sanitizer, wipes, facial coverings. There is a compact included in there, and by that I mean a campus compact contract, if you will. And it basically reveals and reinforces expectations that we have about mask wearing and social distancing and general behaviors during this pandemic in order for us to be reopened this fall. So we are going to distribute those to certainly all of our on-campus students, working with large landlords and property managers to distribute to all off-campus student tenants. And then anyone that doesn't fall into those 2 groups will be able to pick up a kit on campus if they desire to do so. There were also questions about what are we doing on campus as far as classrooms? So yes, we'll be cordoning off specific spaces in our classrooms so that people will be encouraged to social distance. Yes, there's plexiglass going up all over the place. The protocols on hygiene and cleaning are different, and we can certainly talk about some of those things in more depth. But I just think we're probably doing the same kinds of things that the rest of you are doing. And then the other couple of things we were going to touch on in our brief remarks would be education and messaging. You've heard people say over and over again, ad nauseum, that this is a situation that's unparalleled and unprecedented. And the good news for me, in my opinion, is that the silver lining is it's also unprecedented in the ways that we're partnering with our municipal community. So this has offered lots of different opportunities, and perhaps it is simply necessity that for all of us to survive and thrive together, we are going to have to partner together. And so as part of education and, all of the communicating we're doing, yes, we're doing tons of communicating on campus, but it's also terrific to drive into the city of East Lansing and see a banner which will welcome people to town with our very lovable buff Sparty wearing a face mask and saying, let's stay safe in order to stay open. That's one very minor example. But we have a reopening committee, and we're all working together on campus and working across campus and across into the community in various municipalities to communicate with everyone, keep everyone safe, and have those discussions also influenced by our Ingham County Health Officer, who is very involved in all of this, along with the university physician, and taking cues from our governor, Gretchen Whitmer, in the state of Michigan. Also, finally, on accountability and enforcement. There is a continuum of accountability and enforcement. And again, it's going to depend on if you're living on a residence hall floor or if you are, living in an apartment 5 miles north of campus. We have an expectation of all of our students, of our faculty, and our staff that they are going to adhere to what is laid out in our campus compact in order to make this a success. So that's very, very important. And, accountability and enforcement is going to go through a compliance office where you can go online and write about something. You can make a phone call and let someone know if things aren't working out in the way that they should. And the steps from that point forward could be anything from having a conversation and educating folks, all the way to going through some particular sort of protocols through human resources or with our Dean of Students office in dealing with conduct matters and students and the compact. So I want to wrap that up, but also tell you that we have a little bit of an advantage here in that our president is a physician and an infectious disease specialist. So we have been thrilled to have President Samuel L. Stanley Jr. guiding us through this process, along with the university physician and many other key figures. So we're pleased about that. But I will stop talking at this moment and give it back to Britany. Thank you again for letting me be here with you.
Thank you, Sue.
Yep.
So we'll move to Colorado State. Marc, you're muted.
Of course, that's new and part of the lexicon that, yeah, you're muted. Sorry about that. So thank you, Britany, appreciate it. You know, like our friends at Michigan State, there's been a lot of planning going on. We're in a phase that we're deeming recovery, in that the university did not close, and I know that that's a matter of lexicon, but we recognize that we had many essential people on our campus throughout the summer, dating back to March, when we pivoted to a online learning environment. So we're in a recovery process at Colorado State, and a lot of planning has gone into the opportunity to bring back probably 25,000 students is what our estimate now. Typically, we have a in-resident population of about 32,000 students. Like Michigan State, we're an R1 or Tier 1 research institution. We're also the land-grant institution in the state of Colorado. We reside in a community. Fort Collins is about 60 miles north of Denver, a population of about 337,000 folks in Fort Collins. The university is the largest employer in the county, so we know that there's a lot of responsibility that we carry as the university to really do things right as much as possible, to do things safe. Our president has been on record, President Joyce McConnell, really paramount to everything that we've done all summer and what we plan to do this fall is one underlying theme, and that theme is the safety and health of our community. And that community reaches beyond just the borders of our campus to our greater community in the city of Fort Collins and then across the state. We too have been very busy in the distribution of supplies and ensuring that students have hand sanitizers and masks and all of those things when they return. We've also been focused, significant amount of our focus has been on the classroom environment, where we're actually bringing students back for face-to-face instruction. Every detail imaginable, from air studies in rooms to the procurement of hand sanitizers and wipe stations that will be deployed across campus outside of every one of those classrooms. All of that has gone on this summer. You know, the other couple topics that we had agreed that we would discuss early on, not real deep, leave some of it for the Q&A, but accountability in education. So, you know, we've focused heavily on the education side. We have asked all of our students that are returning to Fort Collins to self-quarantine for 14 days prior to coming in. We have testing protocols in place where we will be testing all of our resident hall students and then faculty and staff that have forward-facing positions with students. We've entered an agreement with a lab so that we could get test results back very quickly within 24 hours, which far exceeds anything that's happening in our state currently, so that then we can isolate and contact trace and all of those things. The other part of the education has been around the contact tracing piece and some social norming. We realize that oftentimes in this population of students in this age demographic, that there may be concerns about, sharing where they've been or who they've been with. So we have a committee on campus that's led by some leaders in our Division of Student Affairs to develop a social norming program and campaign that is rolling out as well to our students, to really kind of demystify the phone call that potentially may happen around around contact tracing. We are fortunate in that we have always had a public health office on our campus, and so contact tracing is not new to them. It's something that they've done historically for a long time. We've increased that staff from a staff of 2, frankly, to about 10. So we feel like we're situated there, and educating around all of the things that we're doing is really important. We realize that we're building consumer confidence. We realize that we're building constituent confidence. So that's been our focus. The accountability side, like Michigan State, we've visited our student code of conduct, and policy has been developed. On the student side for adherence, we're in a state that has a mask requirement. So across the entire state, the public health guidance is a mask requirement, and there are, I hate to speak in the term of consequences, but there are consequences statewide for not following the public health guidance. So we have woven those into our student code of conduct. We have HR policy, new policy that's been drafted. So there is an expectation, and we've communicated it out widely, that all of the public health guidance will be followed. And again, I go back to, and I think it's really important to reiterate, that our focus has been on creating as safe an environment as we can, and with a focus not only on our campus, our faculty, staff, and students, but in our community. We've partnered with the city of Fort Collins. Our leadership is in constant communication. My team is in constant communication with the city of Fort Collins, and then with our county health folks as well. So that's where we are, and I'll kind of stop there. I probably should have introduced my title. So my day job, before March the 4th, I was the director of our Adult Learner and Veteran Services in our Division of Student Affairs. On March the 4th, I pivoted into the co-chair of our pandemic preparedness team. And it's been a learning experience. It's been a very busy summer, and unfortunate that I have to do it, but fortunate that I get to make an impact. I've been in higher ed for nearly 25 years, and I've always felt like I was an impact to my campus communities, but no more so than right now.
Thank you, Marc. So we will move on to Tom King.
Thank you, Britany, and good afternoon or good morning, depending on where you are. And thank you for joining in. State College, Pennsylvania is the home to the Pennsylvania State University, and there's a lot of similarities between what you've already heard from Sue and from Marc. State College is in central Pennsylvania, a pretty rural part of Pennsylvania, and actually State College in Penn State is certainly the most urban part of this part of our state. We're a relatively small population, and I think a lot of similarities between State College and East Lansing, as Sue has described. Penn State is the land grant institution for Pennsylvania, and does have 20 campuses across the state. I mention that because everything Penn State's doing COVID related is really they are applying across all their campuses across the Commonwealth, which presents challenges because each one of those campuses also work with local communities where they reside. And you can see the numbers, but again, you'll see the similarities in terms of underrepresented students, very similar to East Lansing, a little over 20%. With 11,000 international students, with over 1,000 student organizations, which also presents a challenge during COVID when those student organizations want to be meeting and coming together and doing the things that college students should be able to do, but things aren't normal under a pandemic. So I want to talk a little bit about the distribution of supplies. Obviously, we all know that that's very critical for the prevention of the spread of the virus. One of the things that the university is doing, even before people get here to receive their PPE equipment that they're going to provide to students, there will be some very robust testing of students. Out of the 47,000 students that will come to State College, University Park, the main campus, Penn State is going to do a testing of 30,000 of those students 10 days before they arrive to campus. 10 days out, they will be mailed a kit. It'll be a saliva test. They will submit the saliva test to the contracted testing company that Penn State has engaged with. And before they come back and can return and actually show up at Penn State, they have to be able to show that they have a negative test from COVID. And that will be 30,000 students that are from the counties across the country that have the greatest rate of infection. So they're picking the hot spots that are occurring, hoping that that would help prevent a lot of that virus from even showing up here. And then once they show up here, Penn State has purchased, like all the other institutions, have purchased masks. I think their original purchase was 500,000 masks that are going to be distributed. Like other institutions, we have in State College, in the city itself, we have over 11,000 rental properties, knowing that each one of those rental properties have 2 or 3 people to a rental unit. We have about 70 to 75% of the student population lives in off campus. Those landlords are each are being given masks and are going to give 2 masks for every student that when they arrive to their apartment buildings for student move-in. And those masks are being provided by Penn State, they say will look really cool and students will want to wear them because they're so cool. I haven't yet seen them though. And in addition to the passing out of the mask, we also, a big part of our efforts are going to be on education. We have created a COVID-19 town gown executive task force. That executive task force consists of Penn State, the city, our local hospital, our county-wide Chamber of Business and Industry, and then our local downtown business district. And that group has been meeting regularly to really focus on 5 key areas so that it's done not just on campus, but it's done throughout the region. The first area is testing. Second is contact tracing. The third is quarantining and isolation. The fourth is enforcement and compliance, and the last is on messaging and communication. As we talk about messaging from an educational standpoint, Penn State contracted with a company called M Booth, who works on health messaging across the country, well-known entity. They are coming out later this week. We've all had a kind of a sneak preview of the messaging that they have come up with. They did a number of focus groups in late July across the city and on campus. And they're coming up with a messaging that will be pushed out here within the next 7 to 10 days. That message is going to be one that's not just a campus message, but it's one that is going to be a message that can be used across the city and the county. It's a kit that will be able to be built on each entity, whether it's apartment buildings, downtown businesses, our school districts, social service agencies, as well as, of course, the university. It will be a message of using the main message as the starting point that M Booth came up with, that will allow each of those entities to have taglines on the message to be able to tweak it for their own use and their own audience. But we wanted to have one consistent message. We originally started to talk about a city message and a campus message. That wouldn't work very well. This will be one message across the whole area. And then one of the things that we did in working with return of students and for safety Penn State in their residence halls have a staggered return that will allow return over a course of 7 days, starting Monday, the week before school starts. And it's being done so that there's not going to be a great number of students and their families moving people into the residence halls all at the same time. They have blocks of time to sign up for when they can show up to move in. But that becomes very challenging off campus where we have the majority of the housing. But we have worked with our local apartment buildings to come up with a COVID-19 plan that each of those apartment buildings have submitted to the city to say this is their plan for encouraging students to come in certain cycles. And while it's not fully controllable, what they're going to do to minimize the risk for students coming in. So they have worked with our health department to have plans that are reviewed by them and kind of signed off, so to speak, just saying these plans look good from a city perspective. And lastly, I'll mention that last night, we have a council meeting that went till 11 o'clock, 4-hour council meeting. The big part of that meeting was the passing of a city ordinance. As Marc mentioned, our state has a masking ordinance. One of the challenges with that masking ordinance is the enforceability of it, though technically the local law enforcement can enforce it. It's an antiquated law. It's under the health law for the state. It also has a $25 fine with it. And while the predominant message will be education and try not to get to the point where we fine people, in the event someone just isn't getting the message, and we've continued to deal with people over again, the city has created a fine that is a $300 fine for someone not wearing a mask if they're closer than 6 feet of another person out in public. It also restricts the formation of lines to enter business districts in the downtown. We get a lot of lines waiting to get into bars. And this ordinance does now restrict the lines in the public right-of-way to no more than 10 people. So once there's more than 10 people, the people have to move on. And the last thing this ordinance does that was passed last night is restricts the number of people that can be at a property to 10 people. No more than 10 people. If more than 10 people live there, such as a fraternity, they obviously can live there, but that essentially means there can be no additional guests. No more than 10 people when an officer shows up to a property, or if there's a yard party. If there's more than 10, they're in violation of the city ordinance. And that is enforceable with a $300 fine. But of course, education will be the way we try to go, but we will, if need be, if we go to the same properties over and over again. And I will point out, as we pointed out last night, that applies to my house, that applies to President Barron's house, that applies to our superintendent of schools and our mayor's house. And it also applies to student housing. So this isn't a student ordinance. It is a citywide ordinance that will be enforced equally. So we have some other things that we're doing. The last thing I will mention, and I'll turn it back over to Britany, is that we have done a lot of work. We have a very large Greek life presence in State College and at Penn State, about 50 fraternities in the neighborhoods. And there's a moratorium on social events. And Penn State does have monitors, employees of Penn State through their Office of Student Affairs, who go around and will be monitoring on a nightly basis those properties. They are required to grant entrance to those monitors to their property, to the general areas of the fraternities, not obviously individual private rooms, but the general gathering areas of fraternities. And of course, if those fraternities are in violation of the city ordinance, the monitors will report that information back to local law enforcement for appropriate action. So with that, I will turn it back over to Britany and look forward to any questions that the attendees may have.
Thank you, Tom. Excuse me. Thank you, Tom. I appreciate that. And finally, we have Councilmember Vercher.
Thank you so much, Britany. I want to say good evening to everyone that's participating in the webinar. I'm Councilwoman Tanaka Vercher. one of the council members of 40 here in Nashville, Tennessee. My day job, I have the esteemed pleasure of serving as Director of Operations at Tennessee State University in the Financial Aid Office. And I would like to speak to education. A lot that's already been mentioned. We're doing those type steps and here in Nashville and at the university. At Tennessee University, we have about 9,000 students. We're the only public four-year institution, land-grant institution in the city of Nashville. And what we did, we instituted back in March a TSU pandemic task force that meets daily to make decisions about the campus and respond to this crisis. In the state of Tennessee, we have a disconnect, and that's the polite way that I can put it, between local government, universities and colleges, and the directive of our governor. In Nashville, we do have a mask mandate, and we also had a long council meeting to debate that and to discuss that. That one was 8 hours. Our meetings have been going into the early mornings. Had one last night, and we ended after midnight. But we do have a mask ordinance in the city of Nashville, and for not wearing a mask, they can be cited with a Class C misdemeanor. Currently, our city, we are in what we call phase 2. We were following just the national trends as with other municipal governments as it related to reopening phases to deal with flattening the curve for the virus. So right now, as a city, retail and commercial businesses, they can continue to operate with 3/4 capacity. Again, masks are required. No gatherings of 25 people. Our gyms are at half capacity. We still have our live entertainment permitted, but dance floors are closed, and our parks, little league sports arenas, splash pads, and so forth, they still remain open. Our restaurants are at half capacity, and bars are closed. I wanted to provide that framework because with it changing daily, and with our interactions and our consortiums with other community colleges and universities and colleges in the state, how other municipalities are dealing with COVID varies for us across the state. So here at Tennessee State University, because it seems the information is fluid and given, we don't know what we don't know, but we're also trying to plan and factor in the other dynamics that we don't have any control over. And that's, we're dealing with, where our students are coming in from multiple places that may not have the policies and the restrictions that we're going to be implementing here at Tennessee University. So we came up with a very detailed reopening plan, and we began educating our families, staff and faculty, so that everyone, if they have an encounter with the student, they can actually provide them the information as it relates to coming back on campus and being safe. Also, we created here at Tennessee State University, we created a specific hotline for students and parents that they can call for any type of reporting concerns. This is a non-emergency number from any type of reporting concerns as it relates to COVID, and questions to, there's a phone line and an email address that we provided to students and parents and faculty and staff, part of that educational space. Again, this task force meet every day, and we try to align our policies with the ever-changing dynamics here in the city and in the state. When our students come back onto campus, the first 2 weeks of instruction will be online. We're utilizing that initial 14 days as a safer in place policy, where we're going to be encouraging students to remain in their residence halls unless it's to perform essential activities, like to get to food or go to medical appointments. But we're going to try to use that 14-day period as an additional safety protocol, along with our daily temperature monitoring. I lost my train of thought. Yes. So with our daily temperature monitoring, that will be required of all students. On the educational piece, what our esteemed president did, Dr. Glenda Glover, she actually held a town hall forum, virtual forum for students and for families, for faculty and staff, for us to one, know what the plan is, and two, what that implementation will look like once faculty and staff come back on campus. Now, we're not going to be fully staffed because here at our university, both faculty and staff have been given the option to either report in person or to report remotely, and divisions had to submit their workflow plan for their respective areas to the administration, so that again, we could make sure, as this is changing daily, that we have proper protocols in place with people that would be on campus. Thank you, Britany. I hope that was beneficial for those that's on the webinar. I was really worried, and this is so beneficial for me also, is, sometimes you can feel like you're out here doing this thing by yourself, and it really touched me, and thank you for doing this, Britany. It really touched me to hear the panelists, hey, that a lot of what we're doing is in alignment with what you're doing. So I think we're
everybody's in the same boat here. That's a common theme with ITGA. We commiserate in pain together. But I wanted to note something. Thank you everyone who's been submitting questions in the Q&A section. And for the participants, I want to also direct you to the Q&A. Our panelists are such rock stars. They've already started answering some of our questions, which I appreciate because our time is quickly floating away. But I would refer participants to the Q&A section. There are open questions still there, which we'll try to get to, and there are some that have already been answered. So I would look at the answer tab in case you have similar questions. You can see the feedback our panel's already given. And we are going to try to jump through some questions that we had for the panelists. Please feel free to kind of jump in but be conscious of the length of your answers, because we are trying to get through them all. I think we kind of touched on the first question that I had, which was really kind of giving us an idea of what your environment would look like for the fall, whether or not you were coming back virtually, your students are going to be on campus, or if we're going to have a hybrid model. So I think a lot of you touched on that one, so we'll skip that. Testing procedures. What testing procedures has your institution or municipality put in place, or will the test be readily available to the student population? And also looking at, will it include off-campus students? And if it is off campus, would it be only the neighborhoods that are closest to your university, or is it, or you're sitting near your university? Like, how are you drawing the threshold for how far you're testing, if you are testing off campus students? I know some of you touched on this in your talks, but does anyone have anything to add on that question?
Yeah, Britany, I can step in real quickly here at Colorado State. So our testing plan is a very, very comprehensive plan, and I think I heard somebody else mention. So we are also working in partnership with a third-party lab testing provider to get results back very quickly. we will be testing all of our residence halls and university housing students upon arrival to campus. And then we have plans for surveillance and effluent testing. So one of the advantages of being at a research institution is you get to work with really smart people. And so from our own campus, have developed some protocols around effluent testing and wastewater testing. And it's a partnership with the city of Fort Collins, where we will be sampling wastewater through 17 manholes. The science tells us that wastewater is one of the earliest indicators in COVID positive. And so we will then be able to isolate where we potentially have a problem as the semester progresses, and then do some pool and sample tests there to try to drill down exactly where we have the problem and start the isolation, contact tracing, and those sorts of things. So it is a very comprehensive program. We also have a partnership with our local county, and our local county is doing free testing 2 days a week, and that is set up on our campus as well. So frankly, anybody from the community can come into that county testing site. Our off-campus residents will be encouraged that aren't part of university housing or our resident hall living. They'll be encouraged to test there as well. And again, that's free testing that's being provided through the state of Colorado down to the county. And then eventually we're partnering in with that as well. So that's what we're doing testing wise. And we know that testing strategies, there's a lot of literature out there. Some of that literature is coming from our own campus, which is good, advantageous. And so the key to any of it is being able to pivot and being able to, as new things come about, being able to be nimble enough to pivot to address whatever those are. And that is inclusive of our testing strategy.
Absolutely. So talk about testing, moving to quarantining. I know some of you talked about quarantining students prior to them coming to campus, but what about protocols in place if for off-campus students, or to isolate roommates of someone who may have tested positive once returning to campus?
So this is Sue again from Michigan State. We are working on, we have some facilities on campus that have been set aside for people who need to isolate or quarantine, actually an entire residence hall building, and then some other facilities within a hotel on campus, and also what used to be some student apartments that are not used as much as they were previously. So we do have that set up for our on-campus students. Off-campus students in East Lansing, we have a number of vacancies in a lot of our apartment complexes, and different landlords are working on protocols for their tenants to be able to do that in some of those buildings. And then if we are also relying, I think, on resident assistants to also say, oh, this person is ill, or a roommate has reported that this person is ill, and then to intervene in some capacity and make sure that that situation is handled and food is delivered to those rooms, etc. So there are rapid response team people who will be handling that.
Okay. I wanted to ask a question about, so how are municipalities and universities addressing the violations of gathering limits and off-campus parties? I know that Tom talked a little bit about the legislation that was passed related to limiting occupancy in buildings and at parties, but how are others addressing that? And with recent talks, because I know a lot of our off-campus enforcement involves either our university or our city police. Thinking about it also from the angle of, with all the recent talks from moving certain responsibilities away from police departments due to concerns with racial bias, overstepping of authority, and maybe unequal enforcement of laws. Like, how are we looking to ensure that the enforcement of our pandemic-related restrictions are done equitably and effectively? Give you the tough question.
Yeah, it is a tough question, and as of 11 o'clock last night, we realized, okay, there's now a law. We have to figure out how we're going to pull all this off and enforce it, because we did we did make the community and the council know along the way there are many enforcement challenges to this ordinance. It's not going to be easy. And one of the things we did point out is exactly what you mentioned, is this is in an environment that not only we're dealing with a pandemic, but we're dealing with an environment around the challenges with defunding police, and police being asked to do more than, things that is not really what they should be doing. So we are talking about not doing mental health checks and those types of things, but now we're going to have police do mask enforcement and enforce health regulations. And so our laws are such that for someone to be able to stop and detain somebody on the street to even begin to enforce that ordinance, it's going to have to be a law enforcement officer based on our rules and regulations. So we are looking at doing some team policing where we, because most of this we think is going to be done by education, is that we want to partner maybe potentially some students who are willingly to help out and volunteer, if not other community members who are willing to volunteer, and not make it, try not to make it just to us versus them, but make it more of a community effort to have some assistance through volunteers or even some paid staff to assist with the educational part of it. And then only rely on, the officers would be present, but only rely on them to take the enforcement action when we have a repeat violator. But we think that to do this well and to try to be equitable and fair, and there to be confidence in what we're doing by the community, that we're going to have to involve others than just enforcement staff.
Absolutely. And with the possible violations related to social distancing, to the mask and gathering restrictions, has anyone thought about, or have you already seen that this may necessitate a change to your student code of conduct? And if so, or will it change the way that your code of conduct is enforced?
Yeah, we tackled that very question early this summer, and realized that a change to our student code of conduct, simply because of the legalities and necessity of bringing in multiple people to actually change the code of conduct, to put language in the code of conduct about wearing a mask and those sorts of things, were going to be very, very difficult. So we pivoted to, rather than opening up the student code of conduct, we pivoted to a policy process for our student population, and that would be a violation if you violated the public health of the student code of conduct expectations. So it had to be very clever from a legal perspective about how we address that. But that language is now set, and again, part of our social norming. And so students are being notified of what the public health expectations are, and not compliance with public health then becomes a violation of the student code of conduct.
And then Penn State College, probably like a lot of you, they have a pretty robust off-campus code of conduct. And so, for a couple decades now, all of our violations that are issued in the city, whether it be underage drinking or noise violations or public urination, all of those violations, those citations, are sent to Penn State Code of Conduct. Those violations get sent to them on a weekly basis. They determine who are students and who aren't, and if they're students, they do notify the students that they've been informed by the city of a violation. Penn State has said that any violations of this new ordinance, they said even in advance of it passing last night, they were pretty clear that they will take appropriate action against students who are committing COVID ordinance violations off campus, and treat them the same way they would as if they commit those same violations on campus. And they feel in their existing code of conduct, they have the ability to do that based on what's been in place for quite a while.
Okay. So I wanted to ask a question also about, and I've seen a few questions, Q&A come up related to this as well. So what's been done in your community to mitigate impacts of students returning to college towns and the large population increase that comes with that? And I saw a question that came, I think it was from Elisa Dreschel, about whether or not, what kind of feedback are we getting from the community about the fact that you have made a decision to bring students back? Everyone's not going to agree with that decision. So I'm just wondering, does anybody have any thoughts about what you're hearing in your community or how the university is handling that pushback?
So I would say that there is no question that there is a lot of trepidation in town, about how students are going to behave. Will they adhere to rules? If it's only a subset that doesn't adhere to the compact, that's still going to affect people. But it's complicated because we also have business owners, restaurants who are like, we need students. I mean, it's difficult for us often in the summer in a normal year. And so there's this, it's a complicated response. There's a lot of fear, but there is also, a hope that somehow this is going to work out. And we are working with, for example, our Responsible Hospitality Council, which is, bar owners, restaurant owners where alcohol is served in town. So we do not have, again, the lines on the street, lines getting into an establishment. We are adhering to a number of people inside and outside a property, et cetera. So those are all things that we're working on. We're talking with our neighborhood associations and letting them know where they can turn if they need assistance. So it's very comprehensive, the conversations and information that we're providing and collecting, and being very aware of what kind of a danger this could potentially pose for our community.
And we all know from the nature of the work that the comments we're making right now are effective as of August 5th at 12:52 p.m. because it is ever-changing. We live in an ever-changing environment. But in that environment, contingency plans are essential. So would anyone like to speak to your college or community approach to preparing for the unknown? What's your backup plan?
That's an everyday part of the work, right? There are many contingencies that have to be thought out, and frankly, we're and I've heard it said often, we're trying to build the ship after the ship has left the dock, and so being able to see around corners and walls that we don't even know exist currently creates this environment that we have to be very nimble and have contingency plans. And then understanding that sometimes our contingency plans, because we're a community partner in our city, in our county, in our state, and we're part of a system, sometimes the autonomy to act on those contingency plans doesn't just rest with us. And I think I heard one of my colleagues say it, and I think that the council member from Nashville said it, that we're in an environment that is more collaborative than we've ever been, and it's out of necessity. And so if there's a silver lining around any of it, I think that will be it. That will be the downstream silver lining, as we've learned as an institution, as the largest employer in our city and county, that we can be more collaborative, frankly.
And I think.
Go ahead, Tom.
And I'm not sure it's responsive, but just maybe in addition to what Marc said, I think that, we're, to some extent, I think that our communities continue to push the city and the university to say, what will cause you to pivot and go a different course? What are those numbers? What's it look like? What's going to happen? And no one is willing to give, and I think rightfully so, it's just impossible to give an absolute number. What we're really focusing on, I think we're in a central Pennsylvania with not a real huge hospital resource. We're not in a big area where we have multiple hospitals. And so I think that, I think as a community, we are prepared to make a change in direction if we begin to see that hospital is getting threatened by capacity and no longer able to handle those cases. And I think to some extent it could be dictated by what the governor does in the state or the Department of Ed, higher education does. I think to some extent it'd be nice if we got that decision made from the state. But lately, our governor, who's been very aggressive about this, and I think has taken this very seriously, is getting more and more pressure to push that decision down to the local level. So I think it's applying more pressure to the local communities to make decisions for themselves at the local level as to when they need to make changes. And so I see it that when our hospitals begin to get threatened in terms of caseload, and not just in volume of positives, but we're starting to get overrun in capacity. I really see things to start to shut down and everything turn virtual again and going back to the way we were in March is probably the backup plan.
Yeah, and that kind of leads me into my next question is, what's the threshold, the possible risk threshold for universities and towns bringing students back? At what point do you make those decisions to shut down and transition back to that virtual environment?
I would add, I think Tom touched on it a little bit. There are a number of factors that we have to look at together. I don't think there's a magic number, and that magic number will differ from community to community. Certainly for us, we are concerned about, hospital capacity. That is definitely a factor for us. Our governor, Gretchen Whitmer, has been, again, at the forefront of being ahead of the curve as far as, masking, social distancing, using emergency mandates to try and keep citizens safe. So these have all been positive, and we've been able to hold the number down, but we now have students coming from out of state and not sure what that magic number is going to be, but it's almost like, we'll know it when we see it. And I think to sort of play off of something that Marc Barker also mentioned is that we have to be nimble. We have to be ready. If the spring told us anything, it's that anything could happen, and we have to be ready to respond as an institution and with our municipal partners. And I think we're all really developing those relationships even further than they've been developed before. We have standing, regular, consistent meetings, and we just have to keep talking, watching, and being ready to move, even if that's not always a popular move or thing to do.
Yeah.
Okay.
The only thing that I'll add to capacity and threshold, just briefly, is that, as Tom mentioned, and we're working with our partners in the healthcare system, and we do have a fairly robust healthcare system and hospital system here in northern Colorado. The other thing, as far as capacity, that we're watching very closely is the capacity of contact tracing, because that could also be the trigger for when we have to remove or pivot to a remote environment. In that when the amount of spread is exceeding the capacity of contact tracing, and we no longer can determine who to isolate, when to isolate, who to quarantine, when to quarantine, because we've now crossed back over into a community spread environment where it's just impossible to ascertain where those contacts are and where the spread is happening. So that's another factor that we monitor very, very closely.
Okay. I want to try to get into one last question that I had, and I've seen it kind of reiterated in the Q&A, so I do want to touch on it. I put it in because I'm an ACC fan, and I figured other people are dealing with this. Any thoughts on fall sports? I've heard both sides of this argument, people saying that, that's not where our priority should be. It isn't, but it's a large part of our campus communities, our student athletes. And it's going to be a large accountability issue for universities as we're bringing back student athletes, bringing back students, possibly bringing spectators to campus, having gatherings. How are any of your campuses or cities handling large sporting events? Since a lot of colleges are issuing their, some of them are pushing back their schedule, making their schedule smaller, limiting to conferences, not limiting travel. But have you had those conversations, or are there any issues that you've seen that's come up at your universities?
We are in those conversations every several times a week, and we're meeting with our athletic staff. We've brought back our fall sports for conditioning and training and those sorts of things in anticipation of having a season. But really, we're in a stance where the safety of our student athletes is paramount. So we've had many discussions on our campus that there's a lot of political pressure that comes from conferences, that come from the NCAA, frankly, that come from television contracts and all of those things. Our president has been very, very clear with our staff on campus and with the leadership of our athletics is that paramount to everything we're doing is the safety and health and well-being of our student athletes. So no firm decisions on any of it now, waiting on all of those external factors to also weigh in, but it's something that we're watching very closely and working with very closely.
I would add, from Michigan State's perspective, we are certainly just playing the in-conference games right now in terms of football itself. And I almost feel like I need to step away and check, media or social media or anything, because something could have happened in the, hour that we've been in this situation. We've had a lot of stops and starts. A staff member has tested positive, or a subset of students on a team, and then we stop practice, and it's a work in progress, and a lot of it does depend on what comes from the national conference and conferences, etc. We meet regularly. Our athletic folks are constantly, well, we could try this. What if we do this? Well, if we don't do that and we, allow X number in the stadium, but no tailgating, so I'm sorry to say, as vague of an answer as that is, that's where we are today. We might be in a different spot an hour from now, but it's something everyone's watching closely, because again, it has a huge impact on the community, certainly from a quality of life standpoint and a health standpoint, as we're discussing here today. But there are financial impacts on the economy as well. But again, as Marc said, the health of our students and their well-being is certainly paramount here.
Yeah, and Britany, I would like to add too, that for us, I want to add this disclaimer too. Specifically, for many institutions, athletics is the driver. So we're delaying opening our season. Many of our athletes are already on campus in isolation, so they've already been here. So we're having conversations as it relates to when we bring the other population of students on campus. Just that dynamic too. But as of right now, we're delaying our schedule, and we have a condensed schedule, and we eliminated some of our larger games like the Johnny Merritt Classic, and we're still reviewing whether or not if we'll have a homecoming celebration this year or not. So just like Marc and Tom is really, we're still evaluating daily as it relates to what we're going to do with our sports.
And unfortunately, we have ran out of time. But I think this is a great conversation, and I hope that it continues. We are recording the questions that we had. I think some of them may have been answered as we've gone on through my list of questions. But if there are questions that haven't been addressed in the chat or in the Q&A, we are recording those and capturing that, and we'll try to get questions out, answers back out to folks. Also, as another shameless plug for our focus group for September, I think that just the notion that these things change every day and your answers may be different in a week, we would like to encourage folks to participate in those focus groups to be able to continue these types of conversations. I'd like to thank our panel. You guys have been amazing. This has been a great conversation. I feel like we could talk for another hour on this and still not get through everything. But this has been really, really fun and a nice break in my work day. I appreciate it. Thank you to all of our participants who came in and signed up. Please keep in touch with ITGA and National League of Cities on more topics like this. We hope to continue to bring these types of webinar discussions to you. And if you have ideas for topics and things that you'd like for us to get together and talk about, we'd also be really glad to hear that from you. So on that note, I'll say good afternoon to everyone and thank you so much for joining us.
Oh, Britany, before we leave, can I put in a shameless plug?
Sure.
Just want to thank my chair, Gloria. She's on also with the University Communities Council. So, and also I don't know if our other vice chair is on as well. So wanted to acknowledge them that they're on to representing the University Communities Council.
Absolutely. Thank you for that. I appreciate it. Thank you, everyone. Have a good rest of your afternoon. Be safe and take care.
Thank you so much. Great job. Thank you.
Thank
Bye-bye.
you. Bye-bye.